OSF On Call is really our digital hospital at OSF. And we serve the entire ministry. There's kind of three sections to it. One is our ergo space, which is an in person space, like an urgent care that we have in many of our communities. One is where I am located, which is where we have like nurse triage. And we have all of our On Call Connect programs. So, our Connect programs are really providing healthcare to patients via virtual visits, telephone, chat, all of those things. And we do a lot of remote patient monitoring in that realm. And then the third part is really all of our scheduling piece around the ministry. We do all the scheduling for x rays and CT scans, as well as office visit appointments, specialists, referrals, things of that nature. So it's really exciting.
The biggest thing I feel like we were trying to solve was the social determinants of health with this specific population. And I really felt like Get Well was fantastic to use for our patients because they felt, I guess, safer talking to us about all of their needs rather than being in person. We were able to use the messaging system of Get Well Loop.
When patients are in a home care loop, they also have our support, and we found that it's very helpful if patients need to ask another question after their visit. We're able to just look at the note. We're kind of able to help support home care from that aspect, so it doesn't need to be a phone call to the home care team. Patients can message us. We're able to remind them of their appointments, which have been fairly helpful. We'll send them a message in the morning just saying, hey, you have this nurse coming out to see you, and it's been more helpful so patients know what to expect. And then a lot of times it's so overwhelming. You know, you're discharged from the hospital, you have all of these people coming in and out of your house, and it's just nice for them to have someone they can just message.
Our patients love this app because they can access the information when they want to, which I think is huge, especially for our demographic. We have like young women. They want, they're busy, they have other children, they have jobs, they have all these things. And it's so nice that they can just pull that app up anytime they want and what's convenient for them. I love the fact that my staff can care for multiple patients at the same time. I know it's just awesome that we can message multiple women at the same time and get help to them. It's obviously different than a traditional appointment. I think, each patient gets 15, 30 minutes. This is great. We can help so many more people. I'm so excited to say that we have almost 500 active women in the loop, and that is just since August.
I think one of the biggest things is it builds trust with our patients. So they know someone is there 24/7, and they are more open to telling us information because they can send it in a message. They can go back and look at what we've said with them in case they forget something. And it kind of just helps. It's convenient. They're able to just send us a message at any time. You know, if they're sitting there eating breakfast, if they're sitting there, whatever they need, they can message us. And we've just found that patients are more willing to seek care this way.
It has truly saved the lives of numerous patients, and you guys have been able to help us outreach to several patients that would have not had resources or help that, now have those access to the help and the healthcare that they need. Everybody deserves that chance to be able to help themselves.